Hi there. A few folks are starting to join. We're just going to give it another minute until we start the session. Okay, I think we'll get things started. Um, Welcome everyone to today's eReferral Ontario information session. Thanks for taking the time to attend. My name is Tara Lonergan, and I'll be your host today. And I also work for Amplify Care's West eReferral deployment team, supporting eReferral deployment across the West region. I'm also joined by my colleagues, Annie and Gina, who are also on this call. Annie and Gina will be monitoring the Q&A during the session. So if you do have any questions that come up and you want to have answered, please put them into the Q&A chat within your Zoom window. Microphones have been muted, and we will try to get to as many as we can, and we'll also take some time at the end to address any that have not been already. The session today also will be recorded, and we will share the recording along with the slide deck following the session. So today's agenda, we wanted to provide a high-level overview of what eReferral Ontario is. So we might have folks on the call who are already using it and just want to learn maybe what's new, what's not new, what's the same. And we might have some folks wanting to learn more and have not started using it. We wanted to provide some of the key benefits that eReferral can bring to you in your day-to-day clinical practice. We're going to discuss a little bit about the onboarding process and how we can support you through that. We do have some West eReferral data and statistics to kind of show you how it's being used currently. And then we will be providing a high-level kind of overview and just some insight as to what the eReferral system looks like. And then again, we will address any question and answers and review next steps. Okay. So what is eReferral Ontario? So today we know that there's still a lot of referrals being sent by fax, maybe paper still being used, by phone. This can cause, increased risk of lost referral forms or uncertainty as to where that referral sits, or did it get to the right clinic. It can increase patient wait time for certain health services, not having kind of that visibility into who's available to accept referrals for certain health service offerings. So we still have a lot of that happening across the landscape today. eReferral Ontario is an electronic referral system. It's a secure digital platform where primary care and specialists can send and receive referrals electronically and securely, and have kind of all those referrals and all the status tracked in one spot and one place. So it does help to reduce significantly those kind of risks of referrals going missing, or clinicians and patients kind of not knowing where their referral status is and what it's at. And it can also help and support, longer term, those long wait times for certain health services and getting patients in quicker when there's more open visibility as to who's accepting referrals, and centralized points of referrals. So a little bit has changed. If there are folks on the call who may have onboarded prior to 2025, you might have been supported by the e-services program. You may have received support from one of our deployment team members. In the late summer of 2025, there was a transition to Ontario Health. Ontario Health now leads the eReferral Ontario provincial program. And so this was really to do an effort to kind of standardize, the fragmented digital health kind of landscape, and trying to work towards a more unified kind of provincial pathway. So Amplify Care, our deployment team certainly still supports the eReferral onboarding across the West. We are primarily responsible now for the community-based clinician onboarding. And then any hospital-based clinician onboarding is now supported through a local delivery group team, which I'll talk a little bit more about on the next few slides. So a little bit of change, but not a whole lot. There's still a lot of that support still available to you, and it still remains at no cost to your clinic. So you can set up eReferral within your practice for free. So some of the key benefits to eReferral and what we've heard from clinicians and MOAs using the system is the real-time referral tracking. So when you send off an eReferral, you as the referring clinician and as the receiving specialist or clinic can see exactly where that referral sits, who it was sent to, and the updated status. So whether it's been booked yet, if it's accepted, declined, whatever that might be, everybody has that visibility into the real-time tracking of that referral. There's improved patient communication as well. So I believe many clinics, primary care clinics, are collecting patient emails now. It's fairly common. If the patient provides consent, you can include that patient email on your electronic referral, and then the patient can be informed and kept up to date as their health referral is sent off, who it was sent to, and they can also receive booking details. They can confirm appointments right in their email. So it definitely takes away the guessing game of, did my health referral get sent, or is it in the hands of the specialists? And it also takes away some of that follow-up that the patients do sometimes with the referring clinic or the specialist clinic. There is some nice secure two-way messaging as well that is built directly within the referral itself. So once the referral is sent off, if there is any type of communication, if the referring clinician had a follow-up question or wanted to check in on things, if the specialist clinic had a follow-up question, needed some updated reports, whatever that communication might be, can all be done in the referral through sending a quick message. There's insight as to when somebody has reviewed, when they've read that message, and things can be just kind of shared back and forth right there versus in kind of different places, maybe follow up on a voicemail or faxing missing information a couple days later. It's proven to be really quick and efficient. The EMR integration is another benefit. So if folks on the call are using any of the TELUS PSS EMR, Oscar Pro, or Curo, these three EMRs currently integrate with Ocean eReferral, and it just allows for a few enhanced functionality and pieces. So referral records can be uploaded into the chart automatically. If you're a receiving clinician, patient charts can be created. They're launching from within your EMR, your patient chart into the eReferral system itself, are just kind of certain highlights that happen with that integration. But certainly if you can use eReferral as a web access standalone system, and you'll still be able to see a majority of these benefits as well. The standardized referral forms is also another, a change and a benefit when you onboard to eReferral Ontario. So Ontario Health and Amplify Care have developed, obviously in collaboration, a lot of clinical expertise, standardized eReferral provincial forms. So if you are a receiving clinician, it would be a requirement to adopt one of these standardized forms for your clinical pathway. And we do currently have about, I think, around 20 or so referral forms that have been created. So medical imaging, there's dermatology, hematology, there's a whole bunch that have already been developed. So this is a requirement, but it is hopefully giving you, as a receiver, the most important information and critical information that you need to initially determine if that referral will be accepted or not. And then as a referring clinician, it hopefully reduces the amount of the administrative burden of filling out multiple referral forms, various referral forms for the same clinical pathway, sometimes with many, many types of kind of questions and information to populate. If you do want to learn more about this, as I said, the slide deck will be shared after. I have linked in here a link to our Amplify Care website where we explain a little bit more about the development of these forms. You can preview which ones have been created. And then just overall, the reduced administrative burden, of the day-to-day and managing, whether it's your MOA, managing multiple referrals for many patients, right? And just those quick wins, whether you're using an integrated system and information can auto-populate and charts can be created, or, the reduction of phone calls in the clinic and just kind of streamlining and having things in one spot is pretty helpful. So how we support in the eReferral onboarding has not changed significantly. Just a few slight shifts in the intake process, as well as who is supporting, which community-based, as mentioned before. So I will reiterate that the West eReferral deployment team is supporting onboarding of community-based clinicians. If you are a hospital-based clinician, if you were interested in onboarding for a hospital program, mainly run out of that hospital setting, you would be supported by one of the local delivery groups. There are 2 across the West region. I did include their contact emails at the end of the slide deck as well. So if you are on the call and that's more your pathway, you can reach out to that group, and they are more than willing and happy to support you with that onboarding process. So on the screen here, the kind of the gray highlighted steps are supported through Ontario Health. And then the blue kind of shaded steps is what our deployment team helps you with throughout the process. So the first step is to officially kind of express your interest to Ontario Health. And you're going to do that through an onboarding request form. So you would complete and submit this onboarding request form. I'll click it here and open it up just to show you. It is on Ontario Health's eReferral webpage. And then if you scroll down on this page, under the Get Started with eReferral Ontario section, there is a complete the onboarding request form option. So you would just click this option here, and then it'll kind of guide you through those steps and what to complete for your official interest to Ontario Health. Just a note, if you are completing this intake form, you do have to be the legally responsible person or the, somebody who has that signing authority for whoever is applying. So that could, it could be a physician in some of the cases. It could be an executive director if you have a fit. So it kind of depends. You can read a little bit more about that if you're curious as to who should be signing that. Or you can also have a delegate sign on your behalf. So sometimes we have MOAs fill out on behalf of physicians, and they just have all that, the LRP information handy. So that would be the first step. Once that's submitted, it goes to Ontario Health, and they will review that intake. In the meantime, between kind of step 1 and 3, we will be flagged on that intake form, and then you will have an opportunity to have an initial connect and chat with your change management specialist on the deployment team. And we just like to review kind of your clinic workflow, what your current setup is. So if you're using an EMR or not, and then just in general, what your site needs and training plans are going to look like. So You'll then get that agreement from Ontario Health once you complete step one. You would review, you'd sign that back, and it's an easy signature, digital signature. It's all electronic. Send it back to Ontario Health, and then our team will be notified once those agreements have been signed, and we can proceed with the remaining steps for onboarding. So steps 4 and 5, sometimes we do this kind of together in one session, but depending on if there's any kind of integration support needed on any EMRs, we might set up an initial session to kind of get that going, get that started, creating your site and your account where you can send e-referrals. And then we will go on to the training and getting you set to be live to either send and or receive referrals. So our team is flexible. We do the training virtually. We can do it in person, one-on-one, group training, really whatever your preference is at the clinic. And I will just mention before we move on, if you're not quite sure, if you want to onboard and you don't want to, officially express your interest, you can, on that eReferral webpage, there is an expression of interest form that you can also fill out with a little bit of your clinical information and what you're looking to learn more about. And you will also be connected in with the appropriate deployment team, and we can, further discuss. Maybe you want a review or a demo of the system more in depth, or just you have some additional questions. That's also an option to you as well. Okay. So just before we get into kind of the review of eReferral, wanted to show you some high-level eReferral highlights currently across the West region. Just noting that this data here on the screen is reflective of those eReferral users who had onboarded prior to eReferral Ontario to that transition. So wanted to note that. And then also wanted to note that there was that provincial procurement for the RMS. And so there was a pause between that 2023-2025 date. But just starting with just this fiscal year, up top, we've had just over 156,000 e-referrals that have been sent across the West region. And the user satisfaction and the patient satisfaction are quite high. So there have been surveys sent out and feedback collected from our users, from our clinician base, and folks are really overly satisfied with the system and how it works, and the patients are as well, which is great to see. And then the data along the bottom here is just cumulative data from the start of eReferral. So eReferral was initiated back in 2015 with a small group to start with, and then it rolled out more broadly in 2017. But until that time, those are the numbers we're kind of seeing now. So there's been over 2 million e-referrals sent, over 5,000 clinicians who are set up to send these e-referrals, and just over 1,000 receivers. And lots and lots of patients being supported, which is great as well. So it's definitely not anything new. It's a mature network and model, and we're hoping to just continue to spread the awareness and continue onboarding folks to the system. So we have stronger networks, and we see these numbers kind of continue to grow. Okay, so I'll pop into the demo now. This will be, again, it's a high-level demo. We're certainly happy to connect in with you one-on-one if you want to see a more in-depth demo. I will also be demonstrating today using kind of the web access, the standalone workflow. If you are using an EMR, so if you're using that TELUS PSS, the Oscar or Akiro EMRs, and you are interested to learn more about how specifically that works together, I did want to note that we have recorded eReferral webinar sessions that cover the workflow across all those EMRs on our Amplify Care website. So if you go to the Amplify Care website and you go underneath the eReferral information page, you'll see all of those different videos. So I encourage you to go there and take a look. But yes, we're also happy to connect and meet with you to go over this in more detail. So the Ocean landing page here is where the clinician would come in to initiate a referral. So I'll cover kind of the sending of the referral workflow to start. Again, if you are using an integrated EMR, this can be easily launched from the patient's chart, or if you're using it from web access, you would just put in the URL and log in through your Ocean login. You're going to access this little menu option up here, and then you're going to navigate to the help map. This brings you into the interactive directory listing, which is quite nice. It's populated by the CPSO directory listing. So even if, a clinician is not active on eReferral, you might still see their listing appear on this map because that's how the information is being pulled and populated. If you are using an integrated EMR, the patient address will default in this search bar here. So wherever we're searching near. You can also manually change that at any time. You can search for different regions, whatever you would like. And then in the Find Any Health Service search bar here, this is where you can search for a specific specialist name or a health service offering. So if I knew, if I wanted to send to a dermatologist but in Waterloo, but I knew that doctor's name, I could type in the specialist's name, and then they'll appear on the Ocean Health Map. If they are live to accept eReferrals, you'll see this little green arrow here beside the listing. If they are not, you won't see that green arrow there. But as mentioned, all the information pulls in from that directory listing. So if you click on the listing, this will show you a little bit about the services that this specialist offers. This is totally customizable. So if we are setting you up as a receiving clinician, we work with you to create this listing setup. We'll get it going for you, but it is kind of up to you as to what you'd like to highlight on there. But it's typically, helpful information for the referring clinician. After that, if this looks like a good specialist to send their referral to, you're going to click this Send eReferral button. And then this brings up that electronic referral form. So the patient information, if you are on an integrated EMR, this will all pull in and populate for you. This is also where the patient email can be inputted as well. So they're kept in the loop on their referral status. If you scroll down, you're just going to see the appropriate referral form for that specialty. And so it's pretty straightforward. It's pretty intuitive to fill out these referral forms. You would go through and you'd select what's appropriate for this patient. Any field that has an asterisk there is mandatory. So as mentioned before, you would not be able to send through a referral if any of those fields were left blank. So you'd be prompted to come back. They would highlight the fields that need to be completed before you're able to send off that referral. So hopefully getting more completed referrals to the specialist clinic initially. And then again, just as mentioned before, the rest of the kind of information would be optional. If you are on an integrated EMR, the cumulative patient profile information that will pull in. You can always edit things in here though as well. And you can add attachments. So if you had any reports or lab work you wanted to send with this referral, you can add the attachment. If you're using it as a web-based access, you typically would save a document to your desktop from the patient's chart, or wherever you have that file saved, you would just upload it. If you are using an integrated EMR, there are ways you can attach reports and images and so forth from the chart, and they'll automatically load within the referral form. So they're here. And lastly, I just wanted to mention that you are able to copy also other clinicians on a referral if you want them to be in the know that you've sent this referral off for the patient. So you would just start typing in, your clinician, you want to copy their name. Again, it's all populated from that Ocean list. And then they'll be included on any important updates on that referral status. So then you click the send eReferral button, and then it's sent off to the specialist to that clinic. Just another few quick things that I think might be helpful to show. If you were to search by health service offering on the health map, and you could change, again, you could change your area here. And let's say I wanted to search for cardiology. Again, the health map, it's going to bring in listings that are nearest to this location. Sometimes you do have to adjust the distance here. But you can see, again, those listings that are accepting eReferral, and you can see the kilometers, the distance to whether it's the patient's address or that region. Wait times can be displayed though, which is also very helpful. So, if the patient just wants to get in somewhere quick, that's helpful. I know medical imaging like DI has a lot of wait times listed for, MRI, CT. But if the receiving site does have their wait times recorded, then you'll be able to see those as well in this list. You can mark lists or listings as favorite as well. So it's quick and easy when you come in to launch your Ocean Health Map, you'll have them saved as a favorite. So you can just open up that listing and send off your referral. So I think that kind of covers high level the health map, but it's a really great directory. I mean, even if sites aren't live on Ocean eReferral, I think it's helpful for clinics to even see who's on and who's available and what that clinic information's is. But once a referral is sent off, it essentially then it moves through your buckets here on the left-hand side. So right now I have my sent eReferral folders open. And so as that referral goes through, you'll see the status change. You can see a quick overview here of the referrals, quick status update. But essentially they'll go through and then they'll be booked. There's also like those e-messages happening. So I'll just open up this referral here and show you. This was a referral that was sent off by me the other day, and I had sent some messaging through here to the clinician. They responded back. So this is where you can do the that e-messaging directly within the referral. And you can review it and close it out. Once the referral is booked, it will land in one of your booked and confirmed or unconfirmed folders, depending on the status. And this is where you can come in and see all the details on that appointment. So all the appointment information back to the clinician and to the patient will be uploaded here. So you don't need to fax or call the clinician back outside of Ocean eReferral when it's uploaded in here. And then you can also see if the patient was emailed the information and who's confirmed it. So all that information is down there. This is maybe I'll pop, I know we're almost at time, so I don't want to spend too much longer, but I will just pop over maybe and show you just from the receiver's end. Again, it's very similar. So they'll move through the folders as need be. But as a receiver, this is also where you're kind of receiving those new referrals. So they'll end up in your new inbox, and you can see that referral here. You can open it up and you can do a preview of it. You have all the referral form summary information here, so you can review that right away. And then any reports or images that are attached to the referral can be previewed and uploaded here. Okay. But again, same kind of functionality. If you had any follow-up questions, you could e-message back, or you could directly accept this referral and then proceed with booking an appointment. I think that probably there's a lot of different kind of functionality and things you can do in eReferral that enhance the overall process and management of referrals. But I think for today we're almost at time, so I think I'll stop there. But again, happy to connect with anyone on the call to do a more in-depth workflow based on your clinic setup. Maybe we will pause for some questions. Yeah, maybe we'll pause for questions now if there's any that are here. I'm just going to stop sharing my screen for a second so I can see. And maybe Annie and Gina, if you're on the call, I don't know if there was any questions that were left unanswered. Let's see. Okay.
I think there's a questions about
Yes. Sorry, I can see them now. Yeah.
yeah.
So I think there's some questions. I'm just going to go through. There's quite a few, so I'll go through a few. One of them is, do we have a sense of the onboarding success with specialists? So um, in the slide deck, on the just before the benefits page, where we highlight what eReferral is and how it streamlines the process, there is a QR code to our evidence briefs and our one-pagers. I would recommend, like, if you're interested to learn more about how specialists and senders are viewing the tool and what benefits they've received from it. Take a look through there. There's a whole bunch on our webpage. But yes, overall, I think a lot of success with specialists and those benefits that were discussed at the beginning. But yes, encourage you to go there and read about that. And then there was a question. So there's some questions about if a clinic is already using Ocean to send e-referrals or receive, and if they do need to complete the onboarding request form and sign agreements. So the answer to that would be yes. That is a requirement to onboard to that eReferral Ontario network now. But I would encourage, if there are any users that are currently using it, please reach out to the West Region inbox if you're a community-based clinician. Let's connect in and let's just see what your current state is and then how we can best support you in that transition. We're happy to kind of connect in on those immediate next steps together with you. I think there's a lot. I know we are at time. If there's any other questions that we didn't get to today, please reach out to the West Region inbox. I'm going to pull up my screen here again, just so I can highlight these next steps. So again, as mentioned, if you're new to eReferral and you want to proceed, submit that onboarding request form. And then if you do have additional questions or if you want further support before proceeding, those contact emails are up there, the West Region for the community-based clinicians, and then the appropriate LDG email contacts, whether you're in the Hamilton, Niagara, Waterloo, Wellington area, or the Southwest Erie St. Clair region. So please reach out if we didn't get to your questions. Reach out. We're happy to do a follow-up. And yeah, thank you so much for your time today.